In this video, we will be talking about one of the important topic for NEET PG and INICET, that is the breastfeeding. In this video, we will be discussing the breastfeeding in the few contexts, that is the exclusive breastfeeding, what is colostrum, what is hind milk, fore milk, what are the techniques of the breastfeeding, how are we gonna checking the adequacy of the breastfeeding and the storage of the breast milk. The first topic is the exclusive breastfeeding. What is exclusive breastfeeding? It includes that we need to give the baby only and only the mother's milk for 6 months, from the birth till 6 months. And what after 6 months? After 6 months, you can give complementary feeding along with the breastfeeding. Until how many years we need to continue the breastfeeding? We need to continue the breastfeeding till the 2 years or beyond if the mother is willing or if their lactation is present. Why we continue the breastfeeding till 2 years of age? Because the important proteins, taurine, cysteine, PUFAs, they all helps in the development of the brain of the baby. Hence, we need to continue the breastfeeding till 2 years or beyond. Now, many of the parents ask, is it we are having a very hot climate here, the baby might be thirsty, can we give water in 6 months of age? The answer is no. You even cannot give water till 6 months of age. This is known as exclusive breastfeeding. The breast milk has adequate amount of water, hence no need to give any external complementary feed till 6 months of age. What is colostrum? Colostrum, it is a first milk. It is present till 3 to 4 days. It is highly rich in immunoglobulins. It is yellowish and a thick colored breast milk. Now there is a taboo that many of the people throw away the colostrum, that is the first milk, saying that this is not good for the baby. You should not throw this colostrum because it is highly rich in immunoglobulins and which is very important for the baby. Now, what happened after 4 days? After 3 days, there is the milk known as transition milk, which is thinner as compared to colostrum, and it has more amount of fat and sugar. And after 14 days, the milk which is coming known as the mature milk. Fore milk and hind milk. Fore milk, it is the first part of breastfeeding, and hind milk, it is the last part of breastfeeding. Fore milk is comparatively thinner as compared to hind milk, and fore milk satisfies the baby's thirst and it is rich in minerals. And hind milk, it satisfies the baby's hunger, it is rich in fat and energy, and it is helpful in weight gain. Hence, you should not shift the baby from one breast to the other breast while breastfeeding. If you do so, the baby will not be able to gain the weight, and the parents will complain of that my baby is not gaining the weight, because the first part of the breastfeeding is the fore milk which satisfies the baby's thirst, and the second part, it is the hind milk which is rich in fat and energy, helpful in weight gain. Now, what are all the techniques of breastfeeding? It is divided into 2 categories. First is positioning and second is attachment, also known as latching. Now, how to hold the baby? What are all the positions which are required for breastfeeding? Firstly, the baby's whole body should be supported. Secondly, there should not be any twist in the neck. That means the back and the neck should be in the straight line, and the baby's abdomen should touch the mother's abdomen. The baby's neck should be at the level of the nipple, or that means should be at the level of the breast. Second technique is attachment, also known as latching. In latching, the lower lip of the baby should be everted. Baby's mouth should be wide open and the upper areola should be visible, not the lower areola, and the chin should be touching the breast of the mother. Now, how to check the adequacy of the breastfeeding? By three ways. First is weight gain, second is urine output, and third is sleep. Now, how the urine output will tell you the adequacy of the breastfeeding? We will ask the mother that how many times you change the diaper of the baby. Normally, in 24 hours, the mother should change 4 to 8 times. If it is less than that, that means the breastfeeding is not adequate. How we are gonna checking the sleep of the baby is adequate or not? We will ask the mother that if the baby is sleeping uninterruptedly for 2 to 3 hours after the feed or not. These are the three ways in which we can check the adequacy of the breastfeeding. Number 1 is weight gain, number 2 is urine output, and number 3 is sleep. Now the last topic is the storage of the breast milk. We all know that there are various breast milk banks situated near the nursing room or any hospital situated near any hospital. While we are collecting the breast milk, we screen for all the illnesses like HIV, syphilis, hepatitis B, and hepatitis C. Breast milk banks who all can donate, such like, for example, if the mother has given birth to a baby and baby died for any reason and the mother is lactating, in that case the mother can donate the breast milk to breast milk banks. You can store the breast milk for 6 to 8 hours at a room temperature, and in refrigerator at home you can store for 24 hours. And in freezer, where the freezer is having a temperature of minus 20 degrees Celsius, you can store the breast milk for 3 months. Till 3 months you can store. So thank you very much. This was all about the breastfeeding, which I have concised to my extent, which is important for NEET PG and INICET. Thank you everyone.